It's time for the Russ Belville Show's Cannabis Q&A with Dr. Mitch Earlywine. Dr. Earlywine is a professor of psychology at the State University of New York at Albany and a leading author and researcher on cannabinoids and health, who pins the Ask Dr. Mitch column for High Times magazine. Get your questions ready in our live chat or call in to 971-533-7111 now.
All right, everybody, welcome back, and time for our regular Monday visit with Dr. Mitch. How you doing?
Doing great.
All right, glad to have you here. We always start off by reminding folks that you can call in at 971-533-7111, or you can get into our chat room at Ustream. Just type /login to create an account and to join us. And Dr. Mitch always gets the first word to let us know what's the latest in the world of cannabis science.
A new paper out of the University of Kentucky has a really neat work with animals where they're using cannabidiol transdermally. They have a gel that they spread on the skin of these rodents, and then it's protective against basically some alcohol-induced neurodegeneration. I want to head this off at the pass, though. I don't think that smoking high CBD strains is the way to get away with binge drinking.
Okay.
We do see some amazing results here. At one of the brain sites, there was literally almost a 50% reduction in the neurodegeneration with the 5% CBD gel. But again, binge drinking is for chumps. There's so much great cannabis in the world. Please don't drink too much alcohol.
Yeah, I cringe sometimes thinking about my teenage years when I was binge drinking like crazy. It was kind of a contest. You always wanted to see how fast or how much or in what crazy way you could drink. And looking back now, I really wish I'd have been using cannabis instead.
I got to admit, we've all had our rough days, and let's hope everybody takes advantage of these new data in a way that we didn't.
All right. We've got some questions coming in from the chat room. Randy Brush has a good one. Wants to know, do you think law enforcers are mad because they're losing the war on drugs to drug users?
Obviously, the only ones I talk to are a select sample, but everyone I've talked to has sensed that they're actually going to get better use of their time. A local pot bust that's for a small amount, unless you're really an irritating Machiavellian meanie, it just doesn't seem like the kind of thing that most people sign on for law enforcement to do.
Yeah, I hope so. It just seems a little ridiculous to me. Let's check some other questions here. Dolink is asking, any precautions for cannabis abstention before or after surgery? Like, is there any effect on bleeding time, increase in bleeding, healing, anything like that?
We haven't seen a ton of data except for essentially if scar tissue or stitches are exposed to smoke itself, that can be a potential irritant. So you certainly don't want to smoke and blow smoke into your stitches.
Okay. Be careful with that. Now, I've been doing some stories recently where I kind of bookmark them, and I wanted to get your feeling on these things as well. And this most recent one comes out of, it was an Irish newspaper out of the Independent in Ireland, and it says, high-potency cannabis is putting young people who use the drug heavily at risk of stroke. Oh, my God. So what are they basing this off of, and what is, if any, the stroke risk of using cannabis?
It's curious because when you think about, basically how many people there are in the world and how many people get strokes in the world, you would actually expect there to be more cannabis-related strokes than there are. However, there have been a couple of cases over there in Ireland that were folks who were markedly younger than your average person getting a stroke. So I think one guy was only 33, but we're not talking about teenage kids. I'm apprehensive about interpreting this in part because it's just a couple of cases. And anytime we have just a couple of cases, literally anything could happen. And I'm actually concerned about folks who may not be reporting stimulant abuse, which has been linked to stroke pretty extensively. So the bottom line here, I think, is we have to interpret this with real caution. One of the things that they mentioned in that article was that they thought that blood vessels were grossly thickened in the case where this guy had a stroke, and I can't recall any other data from cannabis grossly thickening anybody's blood vessels. So I feel like this may be a person who unfortunately was born with a risk for stroke and may have coincidentally ended up having a stroke close to the time he used cannabis. We do have some legendary cannabis increases in heart rate that might have contributed, but we're talking about a pretty low base rate kind of phenomenon.
Okay, so pretty much typical UK kind of reefer madness then?
I'm afraid so. I mean, and again, don't take 2 Adderall, drink 40 coffee, and then hold your hits really long. I'm not sure what else to say. This is just general good anti-stroke behavior.
All right. We've been reporting on your attempts to do research on the effects of cannabis use and menopause, and most recently a survey that you've put together. Lively Libra in our chat room would like to know, what's your target sample size, and are we close to reaching it?
Unfortunately, the response has been a little limited. I realize this is not everybody's target set of symptoms. We've been really grateful to the few people who've responded on Facebook, and we've also gone to Craigslist in a couple of different areas. If anybody who is willing would email me at the 420research@gmail.com email, I'm happy to send the link. We also have, both Lively Libra and I have the link right on our Facebook pages. Hoping to get at least 50 people. Unfortunately, we're not even halfway there yet, so maybe we don't have a lot of appropriately aged women listening to the show. But if you know anybody who might qualify, I'd really appreciate you passing it along.
I will pass this along to Madeline Martinez in our next interview, and her entire group of folks. I'm sure they'll get that information out. We'll get you some more survey responses.
Well, I can't speak for Lively Libra, but I, for one, am extremely grateful.
Yes, yes. All right. Here's another story that came through the news since the last time we spoke. Fox reported on this, so be ready. It was called Possible Treatment for Marijuana Abuse Found, and it was a study on kynurenic acid that supposedly blunts the rewarding effects of THC. We've talked about this in previous attempts of, I think it was the French, to make a anti-appetite drug, and it didn't turn out so well. What do you know about this kynurenic acid treatment?
So, I mean, anything with the name acid in its name always gives me a little bit of pause. As it turns out, the efforts to sort of block a receptor in order to keep people from taking a drug that then stimulates that receptor has been, quasi-helpful with the opiates, and then not particularly helpful with a lot of other drugs. And as we saw with it was a weight loss drug released in Europe that blocked the CB1 receptor. It was basically making people suicidally depressed. I mean, we don't have the CB1 receptor by accident, and just blocking it willy-nilly is not a great idea. When you think about the dangers of cannabis dependence, and those horrible withdrawal symptoms like decrease in appetite, I think some crazy pharmaceutical drug is bound to be markedly more harmful than one that has a 5,000-year history of safety.
Yeah, it reminded me of the story we did a couple of years ago where they had found out that lithium could help people kick marijuana.
Again, that just breaks my heart. I mean, here's a drug with some of the nastiest side effects ever, and unless you're having outrageous manic episodes, you really want to stay away from it.
Yeah. All right, there's another story. Before we go on, though, a follow-up on the menopause research. Gothic Prophet follows up, wants to know, is there some way anyone could participate in that survey that doesn't have access to the Internet, knows a lot of women in the target range, but they're not really on the Internet?
I would gladly email that person copies of the survey if I could at least just get me an email address. Otherwise, I'd be happy to mail things if anyone wants to just get in touch and have me mail something. I think that'd be fine too.
Yeah, I'm sure we'll find a way to make that happen. Just email 420research@gmail.com, and maybe, Dr. Mitch emails you the survey questions. You print them out for the ladies. They fill them out by hand. You enter them. I mean, there's got to be a way to get this done. All right, let's take a look. One other study here, and by the way, we're still taking questions here, but running a little bit out of time, so make sure to get them in as quick as you can. But this study that came across, and it was reported on the Seattle Post Intelligencer last week, that headline was marijuana involved in fewer fatal wrecks than other drugs. And it's Dr. Guaha Lee studying this, and they found that compared to narcotics, stimulants, depressants, and especially alcohol, marijuana had the lowest odds risk for a crash. What do you think of this data, and what does it tell us?
In fact, we've had data comparable to this where folks drove in a car high in Amsterdam. Roby had these data out in the late 90s, and what we've seen is essentially folks who are using cannabis and driving. First of all, they're rather reluctant to drive in the first place, but they were sort of forced to in this lab setting, and they were less likely to try to pass other cars. They were much more likely to have a good stopping distance when they saw a stop sign. They were much better than folks who had alcohol when it came to things like trying to drive fast or tailgating or any of those things. The one area where they do seem to have a problem is that staying right down the center of the lane. And it wasn't like they were swerving all over the place. They just weren't particularly good relative to the placebo group. And I feel like, no one should drive impaired in any way, whether it's Benadryl or not enough sleep or too much cannabis or anything like that. But as we can see from this data and that study you just mentioned, this is not an outrageously high-risk thing when you compare it to a lot of the other contributors to driving. But what I suggest, given the way that people drive, is they leave more space between their car and the car in front of them. They have more stopping distance. They go slower. Don't drive high, but drive as if you were.
There you go. And one thing that wasn't covered in this study, but I always like to bring up, is that we can also calculate odds risk for non-drug related activities, and that we find things like, distracted driving, being tired, can be, even being over the age of 60 can be greater causes of accident, or greater correlation of accident risk.
In the early 2000s, there was a link between cigarette smoking and accidents, and it wasn't that nicotine impairs you. It was that people were getting ashes in their lap and looking down and suddenly wrecking.
Yeah, there's a lot of factors to consider here. It's a very, very complex issue. All right, well, folks, if you didn't get the chance to get your question in, I'm afraid we're out of time, but you can always visit our contact page at 420radio.org/contact, or email Dr. Mitch directly at 420research@gmail.com. I'm headed off to Denver for the Drug Policy Conference. Are you attending that conference, Dr. Mitch?
Alas, my wife has said I need to be in town a few weekends in a row. The normal board meeting was just last weekend, and it seemed a little rough to go for yet another conference, but do give everybody there my best.
Understood. And is there anything you can report to us from the normal board meeting?
Well, everybody's thrilled that Paul Armentano is getting that Drug Policy Alliance award, and it looks like the revenue that's generated from the normal website is actually bound to increase thanks to everybody's participation and just going to the website and things like that. The advertising revenues have potential to go up, and we're also going to have our lawyer friends chip in a little more for being listed there. And otherwise, it was just a much less contentious one, a really friendly one, and it seemed like NORML's headed towards some really great things in 2014.
All right, looking forward to it. Looking forward to seeing all the NORML folks in Key West. And Dr. Mitch, thanks for joining us, and we'll talk to you next week.
Take care.
When we come back, we've got Madeline Martinez from the world-famous Cannabis Cafe talking about the Oregon Medical Cannabis Awards.
We'll be right back after these messages from our 420 friendly sponsors. Support these advertisers because their ad money goes straight to the Russ Belville Show. You're tuned into the Russ Belville Show, the voice of the marijuana nation.